then Senator Hasegawa. It's such a pleasure to have you here before us this morning, and welcome.
Thank you,
Like
Chair
to speak
Cleveland.
to your Senate Joint Memorial.
Thank you so much, Chair Cleveland and esteemed members of the Healthcare Committee. I'm Bob Hasegawa, Senator for the 11th District. And first thing I want to do is thank the Chair for, it's been a real pleasure to work with you on this and other things in healthcare. And I know it's been a sordid pathway sometimes, but I think that we're working through this and making progress to show that the state is of one mind when we need to make sure that everybody has access to health care. So first off, I guess you all know what the story is about the need for health care. You hear it every day or every committee meeting. And, you know, I guess I should thank, there's a couple of different groups, Whole Washington and Healthcare for All. And there was different pathways that each one was pursuing to get to universal health care, but I think through this joint memorial, we're able to bring everybody together and say, you know, where's the real solution? And you might say, why do we need a joint memorial? Well, joint memorials are important because it really does tell Congress that we are of one voice, that we do need health care for everybody who lives in our country. So a real quick bit of my history is that I was on this universal health care thing since my days as a union activist. I've negotiated literally over 1,000 or been responsible for over 1,000 collective bargaining agreements. And back in the 90s, it was to the point where healthcare costs were rising so quickly that we were not able to bargain wages. Every dime we could negotiate was going to cover healthcare increases. So I come to the legislature, and that's a very key issue. And I was working on it back in 2004 when I first came into the legislature. I was told back then that hold off on a bill, we're going to create a blue ribbon task force on universal health care. That was chaired by then Senator Thibodeau. Not much came as a result from that task force, and I know that we've done countless studies and commissions and task forces since then trying to figure out how can we get there, but the real solution lies with the federal government. You know, we can do what we can, but we still are just 1/50th of the United States. And we have, the real power and the resources lie at that level of government. So what this joint memorial does is give the government options, the federal government options. It says, please do create a universal healthcare system where everybody has access to healthcare. If you can't do that, please support House Resolutions 3775 by Representative Khanna from Silicon Valley area, which allows states the opportunity to create their own programs. And absent that, just give us a waiver from ERISA or whatever is needed so that we can move forward on our own. So with these options, which are all contained within this joint memorial, we're sending a clear message to Congress that our economy is suffering and our people are suffering from the lack of access to health care. Now, I would say that there's an economic development argument for this as well. I know that there is a huge economy around the healthcare industry, but all the other industries in our country are suffering as a result of it because they're having to cover, you know, there was a mandate, a social compact back in the day that employers would provide health care for their workers. It's become so expensive now that employers can't cover their employees and not able to live up to their end of that social compact. Take Boeing, for instance. Their health care card, they had to file a WTO complaint against their competitor in Europe, but saying that they're being illegally subsidized. But is healthcare really an illegal subsidy because they provide national health care in Europe and we don't? And so Boeing is having to pay this extra cost. So this would lower the cost due to the economy of scale that the federal government provide, or that the state could at least provide, and support our employers here locally and make for a much healthier and better workforce here. So I appreciate your helping me send this message to our federal government that they need to act one way or another to provide access to health care for everybody in the state. So I appreciate your support, Madam Chair.
Thank you, Senator Hasegawa, for